Hello everyone, my name is Maharlika Diarse and I'm going to be doing the colostomy bag skills video. Before we start, I have my Nightingale scrub top, Nightingale scrub bottom, my Nightingale badge. My hair is up. There's nothing on my nails, nothing on my wrists. I have my trash bag right here, colostomy bag, colostomy ring, and my patient right here, and the stoma, gloves, 2 wash rags, stoma guide. I'm going to pretend there's an adhesive barrier tube right here, and that's it. And I will begin. I'm going to knock on the door, pull the privacy curtain, wash my hand. Hello, Ms. Smith. My name is Maharlika Diarse. I'm going to be your nurse today. Could you please provide your name and date of birth? I'm going to check her wristband. All right, perfect. All right, Ms. Smith, I'm going to be removing your colostomy bag and ring because your provider said so, ordered so, and we will put on a new one as well. All right, and now if you have any questions or pain or discomfort during the procedure, just let me know. Also, if you could please refrain from touching your stoma or around the area of the stoma so we can prevent any bacteria going into the stoma. Okay, all right, so I'm going to wash my hands. Wash my hands. I want to take off my badge so it's not hanging over the stoma or my patient. I'm going to place it away. I'm going to wash my hands again since I touched my badge, and now I am going to put on my gloves. All right. Ms. Smith, I'm going to take out your colostomy bag. All right. So in order to take out the colostomy bag, I have to unclip it from the colostomy bag ring and just unclip it slowly away from the stoma and making sure that the patient is not being hurt. Ms. Smith, are you okay? All right. So it depends on the provider's order if we need to measure any contents that is in the colostomy bag. In this case, the provider said just to dispose of it, so we will dispose of it. In the real world, I will dispose of it, but since I am only provided with one colostomy bag, I will pretend it is new during this skills video, so I will put it aside. Now the stoma is open, and now we will take out the colostomy stoma ring. So in order to do so, we will pull back right here, and holding down the skin, I will pull back right here, making sure the patient is not being hurt. Pull back slowly, making sure that the skin is not being taken out, and it is out. Okay, so I will typically dispose of this, but since we need this for the skills video, it is new, and we will put it aside. So now we have to clean the stoma area. Ms. Smith, I'm going to clean your stoma and around it with the solution that the provider ordered us. So I'm going to get the wash rag with the provided solution that the provider ordered, and making sure that it is warm with warm water. And now we will clean around the stoma in a circular motion. All right, Ms. Smith, I'm just going to clean around it. All right, I'm making sure that it is clean, and then just switch the wash rag again, and the other side, making sure it's being wiped around. Now I will throw this away. Now we are going to assess the stoma, making sure that the tissue integrity is good, there's no tissue breakdown, the stoma is beefy red, and also while we are cleaning the stoma, and if it bled a little bit, that is typically normal. So in this case, everything looks normal. All right, Ms. Smith, everything looks good. So now we are going to measure the stoma with our stoma guide. So I already measured it before the skills video, and it is 1 3/4. Making sure that it is 1 3/4. We measured it. Perfect. So now that we have measured it and we have our new colostomy ring, we will put it over right here and trace around it. Now that we have traced around it, now we can throw the stoma guide away. We don't need that anymore. Now we will cut it now that it's already pre-cut. So it's pre-cut, and then now we are going to dry the stoma. It was already drying, but we need to pat dry it with a new wash rack. So Ms. Smith, I'm going to pat dry around your stoma. If you feel any pain or discomfort, just let me know. So I will pat dry in a circular motion. Now I can switch the wash rag and pat dry again. Alright, and now I will dispose of this. Now that it is pat dry and it is dry, now I'm going to get my adhesive barrier cream. So I'm putting it around. Miss Smith, I'm just putting the adhesive barrier cream to protect your skin. So I'm going to put it around. Alright, perfect. So now I am going to apply the new stoma ring. So I would typically take off the wrapper. Now that it is open, I will place it over the stoma like so. Miss Smith, are you okay? Are you in any pain or discomfort? No. So I would, with the warmth of my hand, I would make sure that it is sealed all around right here, making sure that there is no leaks and everything looks good. All right, perfect. So now we will get the new colostomy bag. Now we will place it over the stoma gently, and Ms. Smith, we are going to place the new colostomy bag. I'm going to make sure that it clicks. Alright. And Ms. Smith, I'm just gonna hold both of my hands over your stoma and the colostomy bag, just making sure that it's sealed and it is on there correctly, making sure that there's no leakage, okay? Okay, now we are going to inspect if there is any leakage anywhere or any open areas, making sure that it is secure. All right, and now typically this is open. The colostomy bag is open since it is a new colostomy bag. I would roll it. And now these clamps or these flaps, making sure that it is secured so none of the new contents from the stoma will leak onto the patient. All right, Ms. Smith, we are finished. I'm going to cover you up. Now I'm going to take out my gloves, dispose of them. I'm going to wash my hands. All right, Ms. Smith, now that you are covered up, here is your call light. Are you in a comfortable position? All right, if you need anything or if anything is wrong with your colostomy bag, just please let us know. Just ring the call light and we will be here shortly, okay? All right, everything's good. I'm going to wash my hands. And now I'm going to document my findings and let the provider know that we have changed the colostomy bag for Ms. Smith. Thank you.